For the second day running, this was the situation across all public hospitals. Patients forced to camp at public hospitals as the nurses' industrial strife entered its second day Tuesday. Untold suffering, especially for those with terminal illness, with many forced to be discharged from hospital beds due to lack of personnel to administer medcare. The 48 hours industrial strike has already claimed 8 lives, 1 in Baringo County and 7 at the largest referral hospital in Coast that serves almost 5 counties in the region. Confirming the incident, Mombasa County Health Executive Binti Omar says the situation is expected to escalate as all services but emergencies have been suspended.
We had 3 deaths in casualty emergency department, had 2 cases from road traffic accident, severely injured patients, 1 with severe chest injuries and fracture of the femur, and 1 was severe head injuries. So severe chest and severe head injuries. Both died as they were being attended to. 3 patients died in the wards. And the first one was a case of stroke. It's a patient who was comatose, in coma, and had a stroke because of high blood pressure. This patient died. Another one was advanced HIV infection. And the third patient who died was a patient who was very ill and had cancer of the bladder.
The impact is very great because the role of the nurses in a facility is very huge. So even right now at Mrima, they did very well during the doctor's strike. But right now, they're having an issue because they don't have nurses to take care of the normal cases. Because in the previous strike, they referred the normal cases to Likoni district. So the impact which will be much greater than the doctor's strike.
Mombasa County Chief Health Officer Dr. Khadija Shakila says they have distributed over 70 contracted nurses across the county and are expecting to employ intern nurses as part of the mitigation measures. The situation replicated in Machakos County, with nurses staging a demonstration demanding full implementation of the 2016 negotiated CBA.
The government was fully involved in this process, but it has come to the last minute that when the CBA was supposed to be signed, the government has negated on its mandate because the COG was fully informed of the progress of the CBA and the nurses leaders. They agreed on a deal, but 2 weeks ago, they agreed that the deal would be signed, only that the COG had invited the wrong signatories.
The situation was similar in Garissa and Kitui counties as patients were forced and left at the mercy of their relatives after the nurses joined their colleagues in the county-wide strike to protest poor salaries.
Rudi kwa yumbani, labda sijafika yumbani, malango ya general hajafunguliwa, aliza kwa hapa mlango kwa ile general, mlango ya karibu ya lami kwa barabara kubwa.
Anzia nimlete, hali yake nazidi kudhoofika na madaktari hapa yani hawamwangalii. Sasa kila siku mimi nanunua dawa, lakini dawa kweli ni kama mimi nanunua shilingi 700 800, lakini dawa hazifanyi kazi.
Families with patients receiving treatment at the county hospitals were left dejected after the management advised them to transfer their sick kin to private hospitals following the health crisis. Only doctors and clinical officers are on duty but handicapped as most of the palliative work is done by nurses. Patients urging the national and county governments to move with speed and resolve the impasse that has yet again plunged the health sector into a crisis.
Hakuna daktari na kazi kwa kitanda tu. Kuna usaidizi yoyote. Naomba serikali sasa siingilie, tusaidie tafadhali, kwa maana nyumbani ni mbali, ni Kisii.
Linus Moshigadi for Channel 1 News.